range needs to be the 1.5 to 2.5 just because that's easier to remember than an odd number.
1.5 to 2.5?
For magnesium, yes, 1.5 to 2.5. I will go in and make sure the exam, if it has anything associated with that, will have that. Magnesium, 1.5 to 2.5. There is another one on phos because phosphates is not in your textbook, so we're going with the purple lab book. And the purple lab book was 3 to 4.5. Was that milliequivalents per liter? Who pulled that up? Is that milliequivalents per liter? Oh, whoa, wait a minute. We need to make sure, yes, what?
There is a graph in our book, a table.
What page?
It has the phosphate level.
Well, we want to go with that. What? Page 22, and what is that phosphate level?
It's 2.
Yeah, see, it only says 2.
There's one in here. There's one in Gould's, but it's in millimoles.
Millimoles. See, there's where the difference is occurring. I'm trying to get it to all of,
2.5 to 4.5
so for milliequivalents per liter, it will be 1.8 to 2.6. So, so for phosphate, we're gonna go with 1.8, 2.6 milliequivalents per liter. Now that's a range. The others did not give you that. But you see how you could become confused, and if you're calling a physician, a provider, and you're telling them some of the lab work, you've got to be absolutely certain that you're talking apples and apples and not apples and oranges. Because that makes a difference when you're reporting these. You need to talk the same language. Milliequivalents per liter of this, not millimoles. And I need to write those down so that I can make sure. So with magnesium, we're going with 1.5 to 2.5, and with phos, we're going with 1.8 to 2.6. Questions? All right, fluid volume excess. Drew, come explain to the class the general premises of what we need to know about fluid volume excess. Somebody. Everybody be selecting your spokesperson.
Okay, fluid volume excess, we're also known as edema.
Can y'all hear her?
Okay, it increases hydrostatic pressure, loss of plasma protein, albumin, obstruction of lymphatic circulation, increased capillary permeability.
Okay, stop right there. What is increased capillary permeability? Remember my soaker hose that had the little holes and you had the sprinkling of all of it? It means instead of the holes of the soaker hose being, say, fingertip, it's bigger. The hole is much bigger. Well, if it's much bigger, you've got more fluid that is going to go out. That occurs when you have sepsis, infections, things like that, because the premise is the body is trying to get more of the white blood cells and the phagocytes and all those things to fight whatever's going on and kill the bugs. But it can also go crazy and you become septic, and that occurs all over the body when the bugs or the infection, I call them the pirates, take over the cell. They cause massive permeability in the capillaries all over the body. You have massive fluid loss into the interstitial fluid areas, and your fluid volume deficit in the vascular system because of this, because it's not pulling it back in. So we'll give albumin to try to help that situation, to cause it to pull fluid back in. We'll also give a concentrated IV fluid, but you'll learn that in 211. Does that make sense as to what increased capillary permeability? So when that happens, you have fluid volume excess, but the fluid volume excess is out in the tissues everywhere. If the fluid volume excess is in the vascular system, you will have an increased blood pressure. But if the fluid is all out in the tissues and not in the intravascular compartment, then you have a decreased blood pressure. Do you understand that concept? Where is the fluid? If the fluid is out everywhere, but you don't have it in your vascular system, you're going to have a low blood pressure. And the body thinks it's fluid volume deficit, but in reality, it is, but the fluid's in the wrong spot, and we need to get it back to the right spot and pull it back into the vascular system. The problem is that when we pull it back in, you as nurses need to assess that patient, because all that fluid hits that system, it's gonna skyrocket that blood pressure, the lungs are gonna get wet, and they'll start drowning in their own fluid, and that's when we'll give diuretics to have them get rid of that excess fluid. So this is where you're going with understanding this content. Does that help? Okay. Yes.
Okay, so some signs and symptoms of edema are localized swelling. Your skin can change to pale gray or red. You can get weight gain, slower bounding pulse, high blood pressure, lethargy, possible seizures, congestion, cough, or else. Your lab values, your hematocrit will be decreased, and your serum sodium will be decreased, and your urine, your specific gravity is decreased, which increases the volume.
Yes. So your specific gravity, whether it's a blood volume, and remember we look at blood volume to see whether you're fluid volume deficit or excess. Normal blood volume on osmoles is 260, around that amount, to let you know whether you're fluid volume excess or deficit. But when you're looking at specific gravity, water is 1.0. So the more things that are in the water increase the thickness of the bean. So if we have a lot of fluid and the kidneys are still working, that's not what's causing the fluid, then your urine output will increase the volume, but there will be less things in it. So if you've been out drinking a lot of lemonade, you go to the bathroom a lot, it doesn't have any color because there's a lot of water in it, right? So the specific gravity is decreased. But if you didn't drink that much and you slept all night, you get up and you go to the bathroom in the morning, first thing, it's real concentrated and yellow and they smell strong. That's why a lot of times we want that first morning urine, because it's more concentrated, it's been sitting in that bladder for a while. Does that help explain the specific gravity? Okay, any questions about fluid volume excess? So they've got that, that weight gain is fluid weight gain. That is the best indicator of fluid retention, is we'll do daily weights. Questions? You got it? All right. We can have so much fluid volume excess that the skin starts weeping and breaking open. You know when you have a tomato that has too much fluid all at one time, it'll start splitting the skin? That's kind of what our skin will do. So, that is fluid volume excess. Fluid volume deficit, do you want to explain that?
So fluid volume deficit or dehydration causes are vomiting or diarrhea, excessive sweating, diabetic ketoacidosis, insufficient H2O intake. That's in the elderly or unconscious, and use of concentrated formulas in infants. Signs and symptoms are sunken eyes, decreased skin turgor, dry mucous membranes, rapid and weak pulse, low blood pressure, fatigue or weakness, and increased body temperature. Your lab values, your hematocrit will increase, your electrolytes will increase, and your urine output will decrease.
Because the RAA system has kicked in, right? Yes.
Your body will compensate by increasing your thirst, it'll increase your heart rate, it'll constrict your cutaneous blood vessels, and
RAA, angiotensin 2.
it'll decrease your urine output, which will make it more concentrated.
Now do those signs and symptoms make more sense now that you understand the RAA system? See? Understand it, don't memorize it. Now, over here, for pediatrics, they'll have what's called periorbital edema. It's where they have edema under their eyes. That's called periorbital edema. Yeah.
The most serious complications are potential shock and decreased blood pressure.
That system is only gonna compensate for just so long before it's gonna fail. Questions of the fluids? All right, let's